Hello, this is Dr. Bruce Kanehl, and I would like to talk with you today about one of my favorite topics in dentistry, and it has to do about TMJ or TMD. TMJ stands for temporomandibular joint, which is the joint right in front of your ears on either side. TMD is actually the dysfunction of the TMJ. A lot of people call it TMJ, but technically the dysfunction is the TMD. This list here on this page, I'm not going to read them all to you, is many of the symptoms that patients have when they come to see me for treatment of temporomandibular joint dysfunction. Headaches is the number one sensitivity that people have. Earaches are common. You can have limitation in opening. You can't open very wide. You have clicking in your jaw joints. You can clench and grind your teeth, ringing in your ears. Even as far off as backaches. I even have had patients with their calves are sore and they get better with treatment. So what do we do for people who have dysfunction of the temporomandibular joint area? In the past, many patients have been subjected to surgery of the joint. It's usually a failure. So I rarely recommend surgery. The non-surgical treatment for temporomandibular joint therapy is usually to make a splint, which is a piece of plastic, as you see on the left side here, that fits over your teeth, that puts your jaw in a position where your jaw now is in its comfortable position in that temporomandibular joint area. If it's just a bite problem and a muscular problem, we call it a centric relation appliance. And this lady on the lower left is what it looks like in the mouth. It's comfortable. You don't know it's there. You can talk with it. It shows when you smile, but you usually only have to wear it for about 3 months. And then we correct your bite, and you don't need the appliance any longer. On the right now is appliances that I make if you have a disc that's out of place in your temporomandibular joint. As if you have clicking, or even if you're locked where you can't open very wide. We call those anterior displaced discs, and we fabricate protrusive repositioners. For that treatment, we make 2 appliances. One you wear at nighttime, which is the top one on the upper, and then one that you wear on the lower during the daytime. We call that our social appliance because you can hardly see it. The upper one is very obvious. It's very comfortable, but you can see it. So that's how I treat temporomandibular joint dysfunction. Now, after that if you have to recapture a disc, it's actually 6 months of splint therapy. After the 3 to 6 months of splint therapy, then an occlusion needs to be established in harmony with your temporomandibular joints. There's 4 ways to do this, and everybody's different. It depends on the severity of your malocclusion once we've established a comfortable temporomandibular joint for you. Some patients actually need jaw surgery to move their jaw. Not very many, but that surgery is successful, where true joint surgery is not very successful. Some people need orthodontics, braces, to move teeth around to establish this optimum occlusion. Some people need a number of crowns to establish this optimum occlusion. This photo on the left is a patient who's had a number of porcelain crowns. And the 4th way is to do a bite adjustment or occlusal equilibration, and that's what the red dots are for. We put, you place ink paper in the mouth and have the patient bite together, and this will show where they're not hitting properly, and we adjust away the spots that don't belong and leave the spots that do. to establish this optimum occlusion. Here is a patient of mine. On the right-hand side is this gentleman when he first came to see me. He was experiencing symptoms like we went through earlier, and he also was severely grinding his teeth, and he did not know why. It was because he had a malocclusion, a bad bite. His bite was not in harmony with his temporomandibular joints. So we first performed the splint therapy to get rid of his headaches and his neck pain and his ear pain, get him comfortable, getting him open easily. And then we needed to establish an occlusion in harmony with his temporomandibular joints. To achieve this, we fabricated 28 porcelain crowns, and we opened up his bite. You can see his teeth on the left are a little bit longer than his original teeth, which was very pretty, or handsome in his case, because he did not show his teeth much before, and now he had a gorgeous smile, and he had the optimum occlusion. These porcelain crowns can last a lifetime. They don't change in color. When he's 99 years old, they'll be nice and white. They won't be yellow like his old teeth. If you're interested in a free consultation about your symptoms, go first to our website at www.kanehldental.com, and you can read in more detail about what we talked about today and see if you may fit the pattern. And if so, certainly give us a call in Jacksonville, Florida at area code 904-731-2162. And we look forward to seeing you soon and making you feel much better.